Welcome to our video workshop titled 1 Minute Preceptor. This video is designed to walk you through a common teaching method using a short 5-step sequence for doing case presentations. What is the 1 Minute Preceptor mode of teaching? 1 Minute Preceptor is a teaching method used to guide the preceptor-student relationship with the use of a 5-step method for case presentations. It is meant specifically for busy clinical practices where time is of the essence, but you have a student and you want to make sure that they are able to acquire the skills that they need without significantly slowing down your workflow. This practice can be used in both inpatient and outpatient clinical settings and is designed to put the presentation's ownership in the hands of the student, capturing their level of clinical reasoning and giving an opportunity for you to provide immediate feedback, all in under a minute. Let's get started. First, get a commitment from your student. You have a busy day in clinic. Let's say your resident who is scheduled to work with you called in sick and your MA is backed up and you have a new student. Now, if using 1 Minute Preceptor, you should probably take a little bit of time with your student before this scenario so that the groundwork is already laid out. But it's pretty easy to get the hang of, and in this setting, it'll come in handy to keep things running smoothly all day long. Getting a commitment is the first step. This is not the I'm coming to clinic today sort of commitment. This is for presenting. It's the time to present to you commitment. The first thing that the student will do when presenting is committing to a diagnosis or a plan up front. This completely takes out the detailed HPI portion of their presentation, which of course we know is very important, but it is often the part that will take a significant chunk of time as well. And sometimes the student gets lost in all of these details. So have them commit. What is your diagnosis? What's going on with this patient? Ask, and ask them right away as soon as they step out of the room. Number 2, probe for evidence. At this point, rather than going through all of the details in a typical HPI, you will want to find out what factors within that HPI that your student so carefully extracted from their patient encounter, which of those will support their decision leading to their suggested diagnoses. This will help assess the student's competence at this stage. What kind of understanding does your student have, and do they seem to have a reasonable thought process? Number 3, give positive reinforcement. You need to tell someone when what they did was good, or they may not ever know. Repeatable behaviors are best enforced when you can compliment someone on something that they did well. Number 4, give guidance about errors and omissions, but focus on only one issue. Maybe 2 if you really have to at most, but try really hard just to stay on 1 so you don't overwhelm the student. You need to give feedback if you expect there to be improvement, but be considerate about it and stay in the moment. This is not the time to discuss an issue that you saw with the last patient encounter. You missed that chance already. Move on and work with the present. Number 5, here's your moment to teach one general principle. You can do this by sharing a pearl of wisdom, mnemonic, or a small piece of advice. Have your student write it down. At the end of their rotation, they will have a whole collection and hopefully valuable clinical pearls that they can carry forward to their next clinical experiences. And that's it. Now, if we put it all together, you can see it in action. Here's a cheesy YouTube video that I found that really helps simplify it all.
Oh, hey, how's it going? Don't ask. We're really far behind in clinic, so I only have 5 minutes for lunch. How come? I have a med student with me today, and he's really slowing me down.
I wonder why he's so slow.
Oh, he's just taking forever to present the cases to me. How can outpatients be so complicated?
When I do a clinic, it only takes my student about a minute to present a case.
What? How does that work?
I just use 1 Minute Preceptor.
1 minute what?
It's one of my teaching tricks. It's easy, it's fast, and it makes me look so smooth.
You gotta give it to me, dude. I'm dying here.
Okay, but you're buying lunch, right?
Okay, but this better be good, and I'm not supersizing you.
Dealio.
Okay, hit me. Seriously, I have to get back to the clinic toot sweet.
Right, so, the way normally the student comes out and they try to present the case to you like...
Yada, 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 presenting complaint, blah, 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 medical and surgical history, medications, allergies, whatever. Oh, yeah, I'm very familiar with all that.
Good, because the first thing you gotta do is skip over all that crap.
Really?
Yeah, just kick it to the curb. Students are supposed to have learned that before they get here. So just skip over that and get to the good stuff.
Are we allowed to do that?
For sure. We're not forgetting about all that stuff. We're just saving some time. That's what the 1 Minute Preceptor is all about.
Okay. So what do you do instead?
Don't worry, man. We got steps. Step 1 is get a commitment.
Whoa. Boundaries. I'm pretty sure we're not allowed to do that with the students anymore.
Oh, no, not that sort of commitment. You just need them to commit to a diagnosis.
You just ask them straight up? Okay, so what's the diagnosis?
Well, I usually say it like, what do you think is going on? Or what do you think we should do?
But what if they're wrong?
Doesn't really matter. You just got to get them to make a decision.
Okay, I think I can do that. What's next? Clock's ticking, dude.
Okay, step 2 is probe for supporting evidence.
Ha! Probing the students, eh?
You really have some issues, don't you?
Yes.
Well, look, you're just asking them to explain their reasoning here. Okay, you think the diagnosis is whatever. Tell me why. If they got the right diagnosis, you want to make sure they got there the right way. And if they're on the wrong track, you need to know where they went wrong. This is the longest step. It can take 30 seconds maybe.
That's half a minute, bro. We better speed it up.
Just focus on the important stuff here, positive findings and relevant negatives. It's pretty quick. At this point, you might go and see the patient together briefly and confirm what your student has found and make a plan.
Okay, what's next?
We're almost done, and the next 2 steps are linked. Step 3 is reinforce what was done well. Pick 1 or 2 things the student did right and let them know they did well.
I love giving positive feedback. It gives me all those warm fuzzies.
Okay, but keep it brief because step 4 is give guidance about errors and omissions.
Can we just skip that step? I really need my students to like me, dude.
Nope, you gotta help them learn, which means telling them when they screw up.
But what if there's 6 things they screwed up?
Just pick 1 thing, tell them, and move on. Remember, you only have a minute.
Okay, I think I can do that. Just breathe. Is our minute almost up?
Almost. Step 5 is teach a general principle. For each case you see with a student, give them 1 pearl. Like a general point that applies to most cases.
Cool, a teachable moment don't mess with the pancreas.
Something like that, or always check for hernias on the abdominal exam. Make sure to check the lipase for every acute abdomen.
Okay, I can do that.
That's it. We're done. Next patient, please.
Really? That was never a minute. That was so fast.
It is fast. But remember, you should do this every time a student sees a patient for you and get them to make notes. At the end of the clinic, you can sit down and review all the stuff they learned today. They should have at least 1 thing for each patient they saw. They learned lots of stuff and you look great. It's a win-win.
And I'm all about looking good.
Yeah, yes you are. Now, before you go back to clinic, can you remember the steps?
Okay, let's see. 1, get a commitment.
Put a ring on it.
2, probe for evidence.
No actual probing.
3, reinforce the good stuff.
Not too much.
4, guidance on stuff that could be better.
Just 1 thing.
And 5, teach a general rule. And then move on to the next patient. Clinic's going to be so lit from now on.
And that's it. Pretty cheesy, I know. We hope you've enjoyed this 1 Minute Preceptor presentation and find it useful in your own clinical setting. Please feel free to reach out to us for other precepting ideas that you may want to share at the email address on this slide here.